We started from the observation that most patients with Hodgkin lymphoma will have a very good prognosis and respond very well to chemotherapy, either first or second line. But there is a very small proportion of Hodgkin lymphoma patients that will fail every available therapy, either chemotherapy or immune therapy with brentuximab, which is a CD30 targeting agent. Those patients have a very bad prognosis, and the only option is PD1 blockade. But PD1 blockade, such as Nivolumab or Pembrolizumab, will give a high overall response rate, but very few CR rate, and CR is required for long-term cure. So we decided to try and enhance the immune therapy with PD1 blockade by providing to those patients high-dose chemotherapy and autologous stem cell transplantation in order to apply the immune therapy when the disease burden is less. The problem is that after autologous transplantation, you usually expect a high degree of immune suppression, and PD1 blockade requires immune cell effector from the host. So we decided to collect lymphocyte before high-dose chemotherapy and transplantation and provide to the patient the Pembrolizumab, the Nivolumab, the PD1 targeting antibody alongside with his own lymphocytes that were collected before transplantation. This resulted in a very high CR rate, 100%. All patients responded to this treatment, and very good survival. All patients that were treated, and we treated 13 patients in this trial, are alive. We performed a control arm because patients were eligible to this trial if they failed every available chemotherapy or immune therapy. Our control arm were made up by patients who achieved CR before transplantation, and usually those should be patients with better prognosis. About half of them will be cured. Indeed, half of them have been cured, but in the experimental arm, all patients are alive. So this is encouraging results. From a biological point of view, we observed that this approach results in an increase in NK cells expansion in the patient treated, and thus probably mean that in a Hodgkin lymphoma patient treated with PD1 blockade, NK cells are the main effector and not CD3 T lymphocyte, which is usually observed in solid oncology when PD1 blockade is more often used.